Most people believe that drug safety comes from control, that without laws, enforcement, and authority, everything falls apart. But that isn't what we see. And nothing, and we've talked about this in the book for all the chapters we've been on now, that just isn't the case. The places where harm is lowest aren't the most controlled, they're the most connected. Where people talk openly, share knowledge, and look after each other. So something doesn't add up. If control was the answer, why has prohibition made drugs more dangerous, not less? And if communities are already doing this better, what does that say about our system? This is part 72 of the video series. We're still in chapter 10, Liberation and Legalisation, but this is the final part of chapter 10 of the last chapter in the book, and then we'll just have the summary and finish the book. So section 74, Community Knowledge and Collective Responsibility. Education begins in the classroom, but matures in the community. The previous section established that knowledge, not prohibition, is the foundation of safety. This section extends that principle outward, showing how learning becomes shared culture. A society capable of living with risk must also be capable of learning together, openly, continuously, and without shame. Community knowledge is not an alternative to formal education. It is its completion. Information flows horizontally, from peer networks, harm reduction projects and festival welfare collectives, to housing co-ops, recovery groups and local clinics. As discussed in sections 55 and 6, the same participatory logic that sustains mutual aid sustains healing. In these spaces, knowledge is co-created rather than prescribed. Test kit passed around a tent, a conversation beside a fire, first aid demonstration at a rave. Each is a fragment of public health rebuilt from below. This shift represents a profound cultural correction. Modern societies have treated health as a service to be consumed rather than a relationship to be maintained. Result, as argued previously, is dependency without intimacy, expertise detached from experience. Community knowledge restores that connection. Duff describes this as assemblages of care, networks in which responsibility is distributed across people, places and practices, rather than confined to professionals. Friedman et al. Show that peer-led harm reduction programs consistently outperform top-down interventions because they convert vulnerability into leadership, users teaching users, survivors guiding the newly sober, knowledge expanding through trust. Responsibility in this sense is not control but participation. Conventional model, state authority dictating rules of conduct, collapses under its own contradictions. As Bancroft notes, prohibition constructs citizens as perpetual minors incapable of moral judgment. Anarchist ethics invert this hierarchy. The adult citizen is treated as capable of discernment, error and repair. The community becomes a federation of small responsive systems, each accountable to its members, not to distant bureaucracies. This is not utopia about realism, the only framework flexible enough to address diverse patterns of use. Examples already exist in practice. In the UK, volunteer-run organisations such as The Loop, Chill Welfare and PsyCare provide non-judgmental support at festivals and clubs, testing substances and advising users with medical prescription and human empathy, precision and human empathy. Across Europe, similar models operate through state-supported civic partnerships, supervised consumption rooms in Portugal, drug checking labs in Netherlands, naloxone distribution networks in Norway. These are laboratories of democracy as much as medicine that demonstrate that collective intelligence can outperform punitive control. Community model also exposes the deeper failure of enforcement, suppresses not only behaviour but dialogue. When people fear criminalisation, they stop talking to those who can help them. Section 60 traces this logic through media propaganda. Here it appears as everyday silence. Replacing enforcement with education is not just safer, it is truer. Truth circulates when power relaxes. The addict who can speak without fear is already halfway healed, because communication itself is connection. As David Nutt and the European Monitoring Centre for Drugs and Drug Addiction both conclude, Successful harm reduction depends less on budget than on belonging. People protect what they feel part of. A young person trusted with accurate information is far more likely to use it responsibly than one shamed into secrecy. This is as evident in Indigenous rights as in modern peer networks. The wisdom of the group is transmitted through example, not decree. Fox calls this distributed stewardship, the socialisation of care through collective attention. Same logic applies to recovery. As Marte observed, the opposite of addiction is not abstinence but connection. When communities learn to hold each other through crisis, they heal themselves in process. Festivals, workshops, gardens, co-ops, these are not fringe experiments, but rehearsals for the society that must follow prohibition. Each embodies the ethics of applied freedom, developed earlier, autonomy sustained through shared rhythm rather than imposed rule. Ultimately, education and responsibility converge in the same truth. People can handle freedom when they are trusted with it. Prohibition infantilizes, participation matures. To live with risk is to live attentively, to see that safety is not the absence of danger, but the presence of relationship. When communities educate themselves, the role of the state shrinks naturally, replaced by what I call, in practical anarchy, care without command. Knowledge ceases to be a weapon, it becomes a commons. Designer drugs emerged as prohibition's most ironic offspring. Each attempt to outlaw a molecule inspired laboratories to tweak it just enough to evade the law. Synthetic cannabinoids, cathinones and opioids multiplied, not because chemistry advanced, but because regulation regressed. In seeking to close loopholes, legislators opened chasms. As McBride and Wilkins note, control systems that react to each new compound simply ensure the next will be less predictable. What began as harm reduction through substitution became harm amplification through ignorance. These substances were not created by communities seeking consciousness, but by markets seeking survival. When cannabis was clamped down upon in prisons, spice appeared, potent, cheap and lethal. Guards tolerated it because it kept inmates docile. Drones delivered it because the system looked away. The illusion of control persisted, while reality disintegrated. My own son spent years inside, caught between that hypocrisy and despair. He saw how punishment produced demand. The more tightly the gates closed, the more chemistry seeped through the cracks. In that sense, the war on drugs has never been about molecules, but about management, a bureaucracy addicted to its own necessity. Synthetic innovation became the mirror of institutional failure, every ban producing a stronger imitation, every imitation revealing how prohibition rewards danger over sense. Researchers such as Winstock and Barrett show that new psychoactive substances flourish precisely where trust collapses and honest information is absent. The pattern echoes the analysis of open source science and care without command developed earlier. Secrecy breeds harm, while transparency breeds accountability. Avoiding this cycle means treating curiosity as a public good rather than a crime. Education and transparency, not fear and censorship, are the real antidotes to chemical roulette. Open source pharmacology, community testing, and early warning systems already model this approach in parts of Europe. If the state truly wished to reduce harm, it would fund these projects instead of prisons. To deny knowledge is to weaponize ignorance. To share it is to disarm the market. In this respect, the movement towards participatory harm reduction, described earlier, points the way forward. Science as solidarity rather than supervision. The next chapter is the summary. This carries this argument forward from education to transformation, asking how a post-prohibition society might institutionalise such trust through law, economy, culture and humanity. So the real difference isn't the drugs, it's whether people are trusted with the knowledge or denied it. Because once communities start sharing information openly, harm doesn't disappear, it becomes manageable, visible and human. Which means the entire model of control, prohibition and enforcement, isn't just failing, it may be making things worse. So if people already know how to look after each other, why are we still building systems that stop them? If that's true, what happens when those systems are no longer needed? Next up, chapter 11 is the summary, and we'll bring everything together and and look at the future.